Good morning, everybody. It's Dr. Galvin with another post-ER update. Things are looking brighter, I think. I'm becoming cautiously optimistic about sort of the prospects of us finally getting out of this pandemic. We've been doing this for a year now. And here at the year anniversary, let's look at the numbers here. A year into this, we've had 119 million cases worldwide, 30 million here in the US, 2.6 million deaths, 535,000 deaths in the US. But, at this point, we've given out 335 million vaccine doses worldwide and nearly 100 million in the US alone. In the US, about 10% of the population is now fully immunized, meaning that you've gotten both doses, and 20% of the population has had one dose. So that's great news. And, despite all of our anti-vaccine people out there, you know who I'm talking about, claiming that, these were going to kill millions and millions of people, we have seen absolutely none of that. The vaccines have been shown to be exceptionally safe. A few side effects here and there, but certainly 100 million vaccinations in the U.S. and very minimal major problems. So we've got a vaccine that's safe, and now we're showing more and more that they're very, very effective. And there's growing evidence that the vaccines actually may decrease transmission. I think I did a video a few weeks ago talking about that. Just because you've been vaccinated doesn't necessarily mean that that you can't get the virus and you can't pass it on to other people. But there are two studies. One of them is a preprint, but one out of the UK that shows that having two doses of the Pfizer vaccine. And remember, when we talk about Pfizer and Moderna, they're really interchangeable because they use the exact same mRNA technology. So I think both of these studies were done on Pfizer, but you can really translate it to Moderna as well. Anyway, that two doses of Pfizer decreased transmission of the virus to others by 86%. And a study out of Israel that's preprint indicates an 89% reduction. And so the ability to reduce transmission is really important if we want to get to herd immunity and things like that. The other thing that's interesting is that there are some preliminary studies out there that show that the vaccines reduce viral load. And so your ability to infect somebody else really has to do with how much virus you produce and how much you give off. And so there is a study, the preprint study out of Israel, that shows that those people who have gotten the full vaccination course, if they do have evidence of the virus, their viral loads are markedly reduced. And if you have a low viral load, it's very difficult to give it to anybody. So all that stuff is good news. And then, for me, last night, for the first time in about 6 months, I had an ER shift. I didn't take care of a single COVID patient. We weren't boarding any patients in the ER. That's the first time in forever. It was busy. We had a lot of sick people, but they were not sick with COVID for a change. And that's a marked change from what we saw, even a month ago. Now, this optimism I have, is tempered by the fact that we've got states that are opening up willy-nilly, and we know that we've got very contagious variants that are out there, and they're growing now, and they're growing probably exponentially. And so it's a race between getting people vaccinated. We're vaccinating 2 million people a day now versus these variants. And if we can get more people vaccinated than can get sick from the variants, I think we're going to be in good shape, because it looks like the majority of the vaccines are good against most of the variants. However, just opening up willy-nilly probably is going to expose a lot of people and get a lot of people sick. I think we'll know that in the next 3 to 4 weeks. If we see another big spike, especially in places like Texas, then we'll know what happened. I think if we can kind of keep things status quo for the next 4 to 6 weeks, then we can probably broadly open up, because I think we'll have achieved herd immunity. I'm on this whole weekend, so I'll do another update later in the weekend. I am tired. I'm going to go get some sleep. I did travel last week to Utah with my 86-year-old dad and my son to go skiing, and we're all, my dad and I are immunized. My son just was careful. And it was interesting. It was pretty uneventful, and everyone was very, very good about wearing their masks and everything else. The plane was crowded, but overall I felt it was pretty safe. So that's nice. It's the first time I've traveled really since all this began. Anyway, more updates to come over the weekend. I hope everybody stays safe. Wash your hands, wear your mask, get immunized. Look after yourselves, look after those around you, look after your families, and I will talk to you soon. Good night.